Hi and welcome to Crack the Boards. In today's video, we'll have a look at USMLE questions related to behavioral science. Let's have a look at the first question. A 52-year-old man visits the clinic and begins crying as he explains that for the past month, he has felt as though he is stuck in a dark tunnel with no way out. He reports persistent exhaustion and difficulty concentrating. Despite going to bed early and falling asleep quickly, he wakes up around 4 a.m. and cannot return to sleep. Over the past few weeks, he has unintentionally lost 12 pounds. Which of the following is the most likely diagnosis? A. Adjustment disorder with depressed mood. B. Bipolar 1 disorder. C. Bipolar 2 disorder. D. Major depressive disorder. Now, the correct answer is major depressive disorder. To diagnose a major depressive disorder, 5 or more symptoms must persist for at least 2 weeks. And at least one of the symptoms should either be a depressed mood or a loss of interest or pleasure. The other symptoms include appetite change such as weight gain, weight loss, sleep issues, fatigue, guilt, and psychomotor changes, impaired concentration, or suicidal thoughts. This all should be in a context where medical causes, organic causes are ruled out. Let's have a look at why the other options are incorrect. Option A is incorrect because adjustment disorder is a depressed mood characterized by development of clinically significant symptoms of depression within 3 months of one or more psychosocial stressors. In this question, there is no evidence of such stressors. Hence, this diagnosis is excluded. Option B is incorrect as a diagnosis of bipolar 1 disorder requires a manic episode. Manic episodes usually alternate with depressive episodes, but a depressive episode is not required for a diagnosis of bipolar 1 disorder. And the manic episodes must last at least 7 days or any duration of hospitalization with elevated or irritable mood and at least 3 DIGFAST criteria. Now, this DIGFAST criteria is inclusive of distractibility, insomnia, grandiosity, flight of ideas, agitation or increased activity, pressured speech, and thoughtlessness. In this question, there is no evidence of such a manic or mixed episode in this case. Option C is incorrect as in bipolar 2 disorder, there is a pattern of at least one hypomanic episode and one major depressive episode. The hypomanic episodes, they only need to last for 4 days and they do not cause marked functional impairment. And there should also be 3 DIGFAST criteria in this case. Let's have a look at the second question. Over the past 2 years, an 11-year-old girl has been experiencing recurrent, uncontrollable movements and sounds that have caused her significant distress. Her parents report that she frequently jerks her head to the side, raises her shoulder, and blinks excessively. Additionally, she often makes sniffing noises which she is unable to suppress despite her best efforts. These behaviors have become a source of embarrassment for her, particularly at school, where her classmates have started to notice and comment on them. Her parents are concerned about her well being and bring her to the clinic for evaluation. Which of the following is the most appropriate diagnosis? A. Attention deficit hyperactivity disorder. B. Autism spectrum disorder. C. Intellectual disability. D. Obsessive compulsive disorder. E. Tourette syndrome. Now, the correct answer is E. Tourette syndrome. Individuals with Tourette syndrome have multiple involuntary motor tics, such as head jerking, shrugging, blinking, and they have vocal tics such as sniffing or grunting, and they last for at least 1 year. Let's have a look at why the other options are incorrect. Option A is incorrect as ADHD is characterized by symptoms of inattention and hyperactivity or impulsivity in at least two settings. Option B is incorrect as a child with autism spectrum disorder has significant impairments in social functioning and communication. Repetitive stereotypic movements often are present, but they are more like rhythmic and intentional rather than being tics. And autistic children usually they are not concerned about others' reactions to their repetitive behaviors. Option C is incorrect because in intellectual disability, it involves intellectual and adaptive functioning below average for a child's age group. And option D is incorrect because OCD is characterized by obsessions and there should be compulsions performed in order to reduce the anxiety from the obsession. Let's have a look at the third question. A 35-year-old man with a severe fear of heights seeks therapy after avoiding situations such as climbing stairs in open spaces, standing on balconies, or driving over bridges. During his sessions, the therapist introduces a structured treatment plan. The process begins with teaching him relaxation techniques such as deep breathing and progressive muscle relaxation to help manage his anxiety. Once he becomes proficient in these techniques, he is asked to close his eyes and imagine standing on the first step of a staircase overlooking a small garden. As his anxiety begins to rise, he is instructed to stop imagining the scene and instead focus on his relaxation exercises until his anxiety diminishes. The therapist gradually increases the intensity of the imagined scenarios over several sessions. This therapeutic approach is an example of which of the following? A. Biofeedback. B. Flooding. C. Modeling. D. Systemic desensitization. E. Visualization. The correct answer is D. Systemic desensitization, because systemic desensitization is a procedure in which an anxiety provoking image is paired with relaxation. Through repeatedly pairing the feared scenario with relaxation, the person learns a new response, easing his anxiety to the previously anxiety-provoking stimulus. Let's have a look at the incorrect options. Option A is incorrect, as biofeedback helps an individual understand his or her ability to influence a physiologic process via the use of an auditory or visual signal. In this, sensors are attached to the patient to measure their heart rate, muscle tension, and skin conductance. The patient is then exposed to anxiety-provoking scenarios, like, for example, in this case, they could be exposed to like imagining standing on a tall bridge while receiving real-time feedback on their body's own reactions. Then the patient learns to use relaxation techniques to reduce these physiological responses, improving their ability to manage anxiety. Option B, flooding, is incorrect, as flooding is a form in which there is exposure of the individual to the most feared item at the start of the treatment. For instance, in this case, the patient might be taken to the top floor of a tall building with a glass balcony overlooking the city. The therapist remains present to support the patient as they confront their fear head on, allowing the heightened anxiety to naturally decrease over time through prolonged exposure, demonstrating that the feared situation is not harmful. Option C is incorrect, as modeling is a technique in which a person observes another individual engaging in a desired behavior. For example, in this scenario, the therapist might climb a tall staircase, stand on a high balcony, or walk across a bridge while explaining their thoughts and actions. The patient observes the therapist's behavior and is encouraged to gradually imitate it under the therapist's guidance. Option C, visualization, is incorrect, as visualization is an anxiety-provoking image, and it's a necessary part of systemic desensitization. And in visualization, the patient is guided through vivid mental imagery to address their fear in a safe and controlled way. The therapist asks the patient to close their eyes and vividly imagine standing on a tall balcony with a beautiful view. During the exercise, the therapist encourages the patient to focus on the positive aspects of the scene, such as the pleasant breeze or the scenic landscape, while practicing relaxation techniques. This approach focuses on reframing the feared situation in a less threatening and more positive light. This concludes today's set of questions, and thank you for watching.